Inspire, motivate, challenge.
Alright, good evening.
Yeah, good evening.
Welcome to Healthcare Soldiers.
Yeah.
So can you please introduce yourself and just give us, tell us about your career journey so far.
My name is Dr. Banjo Tunde. I'm the chief dentist of First Mobile Dental Care. I studied dentistry in University of Lagos College of Medicine. I did my house job also at Lut. And I did my NYC in Kano, and I worked for Kano State Government for 3 years before coming down to Lagos to start the first indigenous mobile dentistry in Nigeria. So, and I started the mobile dentistry 2011, and we've been to virtually all the states in Nigeria. We've treated, and we move our dental van to rural communities where we don't have dental facilities. And we are growing. We've treated so many patients, over 100,000 patients. And we also have a fixed clinic that will treat people that can come into our fixed clinic for dental treatment.
Okay, so immediately after NYSC, you came back to Lagos and started the mobile.
Well, it has always been my passion to start mobile dentistry because I didn't choose dentistry. I chose medicine and surgery, and I just found my name under dentistry. So I was not so happy to have that as a course, so to speak. So, but because of that, I just noticed that a lot of people don't know about dentistry, oral health, and if they don't know about oral health, they can't come in for dental treatment. So that idea came in when I was in 200 level, that we have to take the dental care to people. So that was what I came about the mobile dentistry. So I started with no money. It was the little money I saved when I was 7 that I used to buy a fairly used bus, and the dental clinic was constructed. It was constructed within the country. I sought for the dental chair, all other things, and so I was using that to treat people. So I moved the van from one point to the other.
Okay. So before you get into the funding and how you started the mobile dentistry thing, I want us to just still dwell a little bit on the beginning, or somewhere close to the beginning. So I like what you said. You wanted to study medicine.
Yes.
Right? But you ended up, you saw your name under dentistry.
Yes.
And obviously you must have felt a little bit disappointed.
Yes.
At that point. So, of course, I've known you for quite a while. And when in medical school or in medical, I don't know you. I need you to give your perspective. There was always this perception, right, that dentistry was not like the most lucrative part of medicine. Do you agree? Or what's your perspective on that? I mean, looking at it from when you were in school and now.
Yes. When I was in school, I didn't really believe in that course because I thought, so just about dentistry, about the teeth, and people don't really come to dental clinic for treatment and all that. So I didn't really believe in that course, and I just have to, let me study through and But I thank God that I was given that course because I'm really doing very well. Medicine is very broad compared to, though we have specialties in dentistry. We have about 10 specialties in dentistry: oral, maxillofacial, periodontology, orthodontics, and all that. But medicine, we have more specialties under medicine. But dentistry is lucrative because we have few dentists in Nigeria, and only few schools offer dentistry. About maybe 4 or 5 universities offer dentistries, and of course the population is huge. Population is huge. So dentistry is actually lucrative. But when I was in school, I didn't really believe in it. It was when I started practicing that I know it's cool to be a dentist.
Okay. So I know quite a number of dentists because I work in the pharmaceutical industry, and I know quite a number of dentists who also work in the pharmaceutical industry. Like, I just want to get your perception or perspective on this. Do you think that people who study dentistry compared to other medical fields are most likely to not practice, in your opinion?
Yes, in the sense that, dentistry is about is an art, how to ability to make use of your hands. You combine the theory with practical, and if you don't know how to do, let's say, an extraction, that's one of the basic dental treatments, it may be difficult for you to practice. And because a lot of dentists now, some of them didn't choose dentistry as a course. They either chose medicine or pharmacy and were given dentistry. So perhaps they didn't really believe in that course. So they just said, okay, let me just...
For someone to have chosen pharmacy and get dentistry, or the other way around. You didn't know somebody that had that?
Well, but many people chose medicine ahead of dentistry. But I don't really know much about someone that chose pharmacy, then got dentistry. So just find out some, because they didn't believe in it, they just, okay, let's switch to working in the bank. We'll see a dentist working in the bank, or working in the pharmaceutical to be a detailer, like that. But it's good to be a practicing dentist. You can work till when you are 60, 70 years and you are still good to go. But I was told that the lifespan of a dentist is let's say 30 years, as in terms of practice. That after, by the time you start getting to like 30, you may not be able to do some certain...
Is it because you're working with your hands?
Yeah, and it has to do with, like, now I've done so many extractions and I've started having like pain in my...
Sorry.
So, because you have to use a lot of your strength, your hand and all that to do some dental procedures.
Okay, interesting. So, you said, during NYC, of course, you worked in public practice, right?
Yes.
So, and you said you came back home and started the mobile clinic. But did you work in any other public or other private clinics?
Yes. When I was 7, I also attached myself to a private clinic.
Okay.
So I will work in the government's dental center in the morning. Then in the afternoon, after close of work, I resume to a private clinic. And the reason why I attached myself to the private clinic is to be able to acquire skill. Because dental is about skill. If you don't have the skill, you can't be successful in dentistry. So I was able to gain a lot of skill, from both the private practice and the government, because we're seeing a lot of patients at the government center. Kano is densely populated, so I was doing up to like 20 to 30 extractions a day. Then there used to be a lot of road traffic accident from Okada and all that, because there are a lot of, they call it Achaba in Kano. So we're doing a lot of fixing fracture cases, So I was able to acquire a lot of skill when I was 7. So, and that is really helping me at this time.
Yeah, okay, fantastic. So there's also this perception, it could be wrong, that maybe, I don't know if it's Nigerians or people in general, people don't go to the dentist really for routine, as in just routinely. I know you've talked about more severe cases in your practice when you're practicing in Kano. I don't know what are the most common cases that you see, and is it true that people don't really come to the dentist?
Yeah, truly, people don't really come to the dentists. One, because the awareness is it's improving now because from, our mobile dentistry, because it's community based. We go to communities, we give oral health education, we go to schools, we go to religious institutions, churches, mosques, and all that to educate. So the awareness is improving. But because another thing is aside the awareness, the cost, dental treatments, a lot of people can't really afford dental treatments, like extraction in a private clinic can be as high as like 15 to 20K for simple extractions and all that. So now, because of the costs, people rather want to use their money to buy food or do some, the basic things of life than coming to the dental clinic. So the awareness is not that, and it's not there, but we are working hard. The Nigeria Dental Association is also working hard to do some awareness so that people can come in. And also dental clinics. You only have dental clinics centered in the urban centers. Rural communities, they don't have dental. Now even dentists don't want to go to rural areas. So when you go to rural areas, you see a lot of poor oral hygiene, having dental issues to decay and all that.
Okay, but I mean, just walking into your clinic today, it doesn't seem like people are not really coming to the dentist because your clinic was packed, right? So, I mean, that being said, can you tell me if most of your patients, covered under insurance, or most of them paying out of pocket?
Well, most of my patients pay, let's say, 80% pay out of pockets, and because of the mobile aspect of the mobile dentistry or mobile dentistry business or aspect of our business, we go to communities and all that, and we treat them well. And of course, those people that we treated, they have friends, they have relatives and all that. At the end of the day, they come into our clinic. So our clinic is always very busy, and because of, what we've been doing in the past, we always give the best for our patients, so we have a lot of referrals, so both within and outside. Like today now, the patient I saw came all the way from US to come and have dental treatment. So we've been getting patients from outside the country too. Nigerians, dental treatment is very expensive outside the country. So because they believe in us, because of our ratings, so they come during their holidays, they come to have their dental, and those cases are advanced cases, and they are always very happy.
Yeah, it's true. And I think, like in America, for instance, I think even the dental care is not covered under their own insurance.
Yes.
And it's very expensive.
Very expensive.
So that makes a lot of sense.
Yes. So
I want to really go into the mobile thing.
Okay.
Yeah. So, but I want to first, what you said this is the first of its kind, right?
Yes.
Yeah, that you started in Nigeria. So what even made you come up with that idea to get a bus and a chair and going around?
Yeah. As I've said earlier, that I didn't know about dentistry. I was given, and if at that time I didn't know, that means a lot of people don't know. And if they don't know, they can't come to your facility for their treatments. So it's better as a dentist to take the treatment to them. So when you take the treatment to them and you educate them, then they will patronize you. And before, I did a lot of research on it. In fact, I wrote a proposal, a very good proposal. I sent it to CBN, I sent it to banks. I didn't get any support. In fact, my proposal was, I think, the fourth best during our NYC. I didn't get any support. I went to banks. I was going from banks to banks to finance that project. Because to bring in a mobile dental van, as at today, will cost almost 100 million. A dental van, a factory-fitted dental van from outside the country, about 100 million. And at that time was around 40 million. And of course, putting 40 million, then that was around 2009, 2010. Putting that into mobile dentistry, and in a virgin lad, I don't even know what to, you know. So I was going from banks to banks. I didn't get any support. It was a friend that gave me a loan of 200,000 as a deposit for the fairly used truck.
Okay.
So, and the money I realized during my NYC and all that, so I just put together to secure the bus, and I also pay parts for the dental chair. So I put the dental chair. Then the company that I got, you know, from outside the country, they sent their brochure on how a mobile dentistry can, a mobile dental truck can be built. So I used that brochure to do my own, or I used to construct my own mobile dental van. So I started small and without any loan, aside the 200,000 that I got from my friend. So I was doing little by little, and we were growing. And God accepted us.
So how, like, so when you created of course you identified the need, you created the van or the bus, the dental bus.
Okay.
So when you go around, you said you've gone to how many states now?
More than 20 states now.
Okay, wow.
Yes.
So when you go to a state, for instance, let's say you go to Abeokuta tomorrow, or in the state.
Okay.
So where do you park it? And what do you say to make customers come?
Okay.
What do you do right
now? Those other states, we don't just go there. Okay. We were invited, either by an NGO or a religious organization or a politician or a philanthropist.
Okay.
In those states. But when we first started, we just parked the van because we didn't really get the strategy on how to go about. We'll just move from a street, maybe a densely populated area, we'll just park our van, talk to people, but it wasn't really working. So we now moved to going to public schools.
Okay.
So went to public schools, talked to the teachers. Okay. So the teachers were coming in at a well subsidized rate. Okay. So we cover most of the public schools in Lagos. From there, some of the teachers had maybe, in their churches, they can do a dental program. So can you come to our church to do this, like that from there? And what actually made us to really grow fast was when we sent a proposal to Lagos State House of Assembly. And that time, many of the honorables were having dental issues. When they saw my proposal, they said, "Oh, wow, a dental van, come to House of Assembly." So when they were there for like 2 months, so in fact, we treated all the staff, we treated all the honorables, and that they paid. So that was what opened up the business for us. Okay. They paid, and some of the honorables, they are also from their constituencies. So they took us to their constituencies. From there, so now we have we just acquired a Mercedes-Benz Sprinter dental van. Which is very expensive, but at least then we have another. So the old one. So that one is old school now. So we discarded that one. So we have a modern dental van.
And it's a Benz.
It's a Benz, Mercedes-Benz Sprinter, and its new model is air conditioned, and so that's what we use. Then we have another small van that we use for small projects.
Okay. That's fantastic. So, I mean, that's intriguing. And you came up with this concept while you were in school.
Yes.
Because of the fact that you felt, okay, I don't really know much about dentistry. How do I really take it?
Oh, yes.
So you think about it in school. And this is a very impressive idea. And I'm not really surprised that you come up with something like that. And I want you to just take us back to school. Because I knew you when you were in school. And I knew you as the guy who did all sorts of businesses. You were a highly entrepreneurial guy.
Yeah.
Right? So I didn't forget. And I just want you to tell us about some of the different businesses you did. Just share with us.
Yes, I came from an humble background, so I have to strive to sustain myself while in school. So when I was in 100 levels, the first thing I did was I sold a detergent. So that's why a lot of people don't even know my first name. They call me Oryx. So the Oryx came from the detergent just to survive. It was a foreign detergent. So I was going from hostels to hostels, especially female hostels, so I was able to at least use that to sustain myself. So when I got to College of Medicine, so I did the first audio anatomy tape. It was anatomy.
Oh, it was just anatomy.
Anatomy. So I did the audio tape, and and I saw that at least I made some money too, and I used that to also sustain myself. And at a point too,
I mean, just so that people understand what you mean by anatomy tape, can you just, because I know what it is, but I want you to say it so that if someone is watching, they understand what you mean.
Yeah, anatomy is one of the subjects we do as a medical student, and it's voluminous, and because of the amount of the volumes that you have to read as a medical student. So a lot of medical students don't have that time, so they can so one is into an audio format, so they can be doing other things. They can be cooking at the same time, be listening, So that's what it is.
Because I remember this very well. Basically what you did was you read the book and recorded yourself reading it.
Okay,
basically like the audio books that are very popular today.
Yes.
You started the idea of audio book back then.
Yes.
And then people could now listen, right? Because I remember I actually thought you did for physiology as well. I guess it was just for anatomy. So thanks. So which other things did you do?
Then I did popcorn.
Yeah,
I did popcorn too. Then, and I was fortunate to be the welfare of the College of Medicine for like 2 years, and we did a lot of welfare secretary. So,
I know there were more.
So,
you can leave it there. So I'm not surprised that you came up with such an ingenious idea as well. So. Now, now I want to go into the first mobile clinic a little bit more.
Okay.
So you came back from NYC, you started, you went around, you were able to get some networks and expand, and so so you've told us how you actually funded or how you got money. But now, if I guess so, from all your outreaches, everything, you were able to make enough funds to actually have the brick and mortar first mobile that we are in now. Right? So it's just all your hard work and everything is paid off. And you have this very great clinic.
Yeah, by the grace of God.
Highly equipped and everything. So when did you open
this fixed link? That was last year.
Okay.
Last year March. It's like a year now.
Alright. So how do you balance your time between going to the field and being in the clinic?
Yes, we have staff for field work and in-house staff for the fixed clinic. So we have many dentists working for us. So I just supervise. Then sometimes I go to the field. Then sometimes I'm in the clinic. So, but it's not all the time that we have outreaches or field work. So whenever we're not on the field, I'm in the clinic. And of course, COVID affected our business during the COVID period. So we couldn't do outreaches. Thank God for the first clinic. So it was the first clinic that sustained us. That sustained us, So actually, during the COVID too, I was moving the van around to treat people that had severe toothache. I took the van, though I was well kitted, and I was doing it free.
Oh wow!
So I did it free for people with severe cases like toothache that couldn't come in, because most of the dental clinics were shut down. So
for the most part, I mean, you started it by yourself, right?
Yes.
So you're the boss now.
The chief dentist.
And all that. So that's a good one. So now, like, you talked about when you were in school, right? You didn't want to study medicine. I mean, you wanted to study medicine, You ended up in dentistry. Now you are doing something very innovative in this space. So if you could go back in time, right? You had that opportunity. You're back in, maybe by magic, back in, and you had that option. Now you could choose. With everything that you've gone through and everything that you know now, seeing your peers who are medical doctors, surgeons, and everything, which path would you follow?
I would choose dentistry over and over and over. I would choose dentistry. I would choose it over and over and over again. I'm enjoying it. It's fun.
Okay.
It's fun.
So if there's a young person, right, watching this now, like a young person who is going to go into school, they want to study medicine or dentistry, like how would you advise them?
Oh, well, it's it's passion. It has to do with passion, because it's not all. It's not all of my colleagues that we started they are doing well now. It has to do with passion. And one thing I know is that for you to be successful in dentistry, you have to just create a niche for yourself. You have to, I created a niche for myself. At least all over Nigeria, they know, okay, when you talk of mobile dentistry, it's Dr. Banjo. Even I do stuff with Lagos State governments, In fact, I was actually the one that gave them the idea of mobile dentistry. It has Lagos State governments. And also a toothpaste, a particular toothpaste company. So
are there other people doing mobile?
But they're not really doing it so well. They're not really doing it.
But there are other people who are
like Lagos State government too. They have their dental, two dental ones, but not really. It's and there's a lot of things, a lot involved in, So it has to do with your passion, but dentistry is very, very interesting. And of course, when in abroad, they are well paid. Well paid.
Okay, so my last question is now, like going back to young people again, younger, potential young dentists. They've seen what you've done, mobile clinic, whatever. How would somebody like that going about starting their own clinic or their own mobile? How would they even start? What would you tell them?
The market is there. The market is huge. Now, let's do this. Let's say I have 1,000 patients, 1,000 clients, and I do scaling and polish for them every 6 months. And they all, let's say even 50% of them comes for dental. 1,000 times, that is a 50% of the 1,000, that's 500 times 10,000 naira. Let's even say 5,000 naira. That's how much? That's 50,000?
50.
That's 50 million. That's 500.
500
times 10,000. That's 50 million or 5 million?
500.
That's 50 million. Is that 5 million?
Yeah, 5 million.
Okay, that's 5 million.
That's
500. That's
4.
So that's routine. That's just routine dental treatment. And if you can, and look at the population. We are almost like 20 million in Lagos State, and 1,000 just a micro fraction of 20 million. So the market is there. So what we need to do is to create the awareness. Let the dental treatment, let it be affordable. So any young dentist that is coming into dentistry, maybe want to start up a dental clinic, you shouldn't be afraid. You should start small, acquire the skill first. That person needs not to start big. Start little by little. Just get a small dental chair. Treat your patients well. So the patients have friends, have relatives and other. Word of mouth referral. From there you grow. So that's what I would tell the young dentists. They shouldn't be afraid. They shouldn't be scared of the dental. Though dental chair is very expensive, but they can come together. Like one or two young dentists can come together and set up a.
Okay, so I like what you said. You are encouraging partnership.
Yeah.
But you didn't have like a partner though.
Because I didn't have.
You didn't have people who were like interested
in partnering. Yeah.
Okay, so you encourage partnership?
Yeah, partnership, we go, especially for young dentists. Because to set up a dental clinic is very expensive. You have to have a space, you have to buy a dental chair, you have to buy dental materials, dental instruments and all that. Or if you can't afford that, you can, 2 or 3 dentists can come together and set up a clinic. And they have a sharing formula. And from there, they'll grow. They'll grow, yeah. But I will not advise a young dentist to start looking for a loan and all that. You know, the money they earn from their house job or support from families and friends, yes, that will help than getting a loan. It's when you have your customer, you have your customer base, then you can project, you can say, okay, yes, with my projection, I can get this loan to expand. It's not when you're starting.
I know how much you're paying back.
Yes.
Okay, thanks very much, Dr. Banjo. It's been a pleasure. I hope you enjoyed it as much as I did.
Yeah.